friends, I am Dr. Anurag Saxena, Head of Department of Neurosurgery at Manipal Hospital's Dwarka, New Delhi. And in this series of videos, we are going to talk about brain tumor. What exactly is brain tumor क्या होते हैं, how they can be treated, उनको हम कैसे उनका उपचार कर सकते हैं और what are the signs and symptoms of brain tumors. मतलब कि ब्रेन ट्यूमर आपको है कि नहीं है, आपको कैसे पता लगेगा या कुछ ऐसे साइन सिम्टम्स आपको देखने हैं जो ब्रेन ट्यूमर के हो सकते हैं. सबसे पहले इन दिस वीडियो वी आर गोइंग टू डिस्कस व्हाट इज ब्रेन ट्यूमर. ब्रेन ट्यूमर एक्चुअली है क्या? सो ट्यूमर इज एक्चुअली abnormal growth of cells inside the body, anywhere in the body. Whenever it occurs in the brain, it is called as a brain tumor. They are usually in the form of abnormal masses of cells, and normally we call them as lump outside the body, and in brain they are called as a space occupying lesion or tumors, or commonly called as brain tumors. So whenever this kind of tumors occur, they can occur from the membranes of the brain, which are called as meninges. They can occur from the cells of the brain, which like astrocytes or other neuronal cells, and then they are called as gliomas. And then there are different locations of the brain tumor, and they can come from different components of the brains. Now, one of the very common questions which is asked is who can have brain tumors? So the answer is there is no particular age for brain tumors. Brain tumors are seen in newborn babies right from 1 day of birth till around old age patients. You can see this kind of tumors in young patients also. It is true that malignant tumors are more common in older age group, but with rapid development in imaging modalities and diagnostic modalities like MRIs, we are seeing this kind of tumors in younger age group patients also. Although it is one thing to be kept in mind is that the tumors in children and in infants are different as compared to the tumors which are found in adult age group, and their treatment and other modalities are also different. So then what the question occurs is, are they really common? So answer is no. Brain tumors are not a common entity, but because we are neurosurgeons and we deal this kind of patients on a regular basis, for us it is a common occurrence. What are the causes of brain tumors? So very common question whenever a patient comes to me, whenever we are asked about brain tumors, the most important question is asked is what exactly causes brain tumor. The answer is largely we do not know. Like other cancers or other tumors, we are not really sure what is the exact cause. Most of the time it is multifactorial. There are very rarely some tumors which run into families, and you have certain syndromes called as neurofibromatosis and so on. And those kind of tumors and those kind of syndromes, you can have tumors which can run in families. There are certain genetic predispositions also which can cause this kind of tumors. Also, very important factor is if you have got radiation therapy for some disease like blood cancer in childhood, and in those cases you can have certain tumors which are called as meningiomas, which can be attributed to radiation therapy. Now, as commonly thought, or as commonly you are reading around that mobiles and use of tablets are major causes of brain tumor. The answer is that up till now there is no conclusive study to link mobile usage or tablet usage with the causes which as a causative factor for brain tumor. Although studies are going on, but it doesn't mean that it can be used regularly. We know that they emit radiation and their use should be limited. Now, what are the types of brain tumor? Brain tumors are divided into two broad categories. One is benign tumors or so-called non-cancerous tumors, and then there are malignant tumors. Malignant tumors, you can say they are cancerous tumors. They spread inside the brain and they destroy part of the brain. Benign tumors are the tumors which usually occur in and around the brain, and they cause compression on the brain structures, and if they are taken out completely, that compression can be removed. Malignant brain tumors have a tendency to spread along the brain and destroy the part of the brain, and obviously the outlook of malignant tumors is poorer as compared to benign brain tumors. Now, in other series of videos, we are going to talk about the signs and symptoms which you have to look for if you have brain tumor, and then subsequently the treatment which we can do if somebody is diagnosed with brain tumor. Thank you.